Guys, good morning everyone. So for the aims norcet examination we have the only 1 week time. So I'll try to complete the most of the questions with a little explanation. So in this class we will see some of the questions and some points to be remembered for the examination purpose. So first question is hypertrophy of ventricular wall is known as. Options are core pulmonale, ventricular septal defect, ventricular stroke, none of the above. So the right option is option A, core pulmonale. So core pulmonale, it's a condition when the ventricular wall, okay, this is a heart and it's a ventricular, okay, the thickest layer of the heart is the ventricular wall. So in this condition, it is a clinical feature of when the ventricular wall become very thick. Why? Because it's mainly we can see in the case of ventricular septal defect. So due to the having of septal defect, the whole connection between the two ventricles, so the left ventricle has to pump the blood all over the body, so it has to work very hard, so it leads to the thickening of the left ventricle. So in the same way, the ventricular wall, when the ventricular walls are has hypertrophy is nothing but increase in the size of the cell. So this condition is known as a core pulmonale. The next one is Decker's criteria is used for. Options are cardiac arrest, pericarditis, pericardial effusion, decreased blood ejection. The right one is option B, pericarditis. So pericarditis is nothing but the cardiac covering layer which is infected by the pathogen, that is called pericarditis. And to find out the pericarditis, we can use Duck's criteria. So based on the Duck's criteria, we can assess the pericarditis stage. The next one is pear-shaped heart seen in. Options are tetralogy of the palate, ventricular septal defect, pneumonia, and pericardial effusion. So the right one is pericardial effusion. So pericardial effusion is nothing but the covering layer of the heart. Okay. So this is the a covering layer of the heart, and in this we have the heart. So in between two we have some fluid for normal purpose to prevent the friction when the heart is beating. So in the pericardial effusion, excessive accumulation of the pericardial fluid, that is pericardial effusion. The next one is, we will see some of the points related to the cardiac system. So first one is central venous pressure is 2 to 6 mm of Hg. Central venous pressure is 2 to 6 mm of Hg. So where we can assess the central venous pressure in the in the superior vena cava, otherwise inferior vena cava. So mainly vena cava we can assess the central venous pressure. Why? Because vena cava is the largest vein in the body. The next one is portal vein pressure is 8 to 12 mm of Hg. And the next one is pulmonary artery pressure. So in this pulmonary artery pressure, we have the systolic and diastolic. Systolic is 15 to 30 mm of Hg, and the diastolic is 8 to 15 mm of Hg. That is pulmonary artery pressure. And the next one is the mean arterial pressure. So mean arterial pressure is 70 to 105 mm of Hg. So where we can assess the mean arterial pressure, that is on the aorta. And the next point is central venous saturation is about 70%. Central venous saturation is 70%. And the cardiac output is 4 to 8 liters. Okay, cardiac output is 4 to 8 liters. The next one is stroke volume is a volume blood pumped from the left ventricle. So when the heart is pumping, so how much ml of blood is ejected from the left ventricle, that is called stroke volume, and that is 70 ml, 70 ml per minute. And the cardiac output is, it is stroke volume into heart rate. Okay, stroke volume into heart rate, it is called cardiac output, that is 45040 in the adults, and in the children's we have the 500. Okay, the next one is the amount of air passing into and out of the lungs. Okay, during each breathing is called tidal volume. So tidal volume is nothing but the amount of air coming into the lungs and exit from the lungs, and the ml is about 500 ml per minute. Okay, tidal volume is sorry, this is tidal volume is the amount of air into the lungs each breathing, that is called tidal volume. And the next one is total lung capacity. Total lung capacity is nothing but how much ml of air is uh, uh, can take the lungs, that is called total lung capacity, that is about 6000 ml, nothing but 6 liters. And the next one is normal tidal volume is about 500 ml. It is the amount of air going into the lungs during inspiration, is known as the tidal volume. Same thing is repeated here. And the next question is how many segments are present in the lungs? 18, 14, 20, 40. The right one is 18. So 18 segments are present in the two lungs. Okay, the lobes are present in the right lung is a 3 lobes, and the left lung is a 2 lobes because the presence of heart. And the postal drainage, so postal drainage can be done in the 18 positions. Okay, postal drainage is nothing but removing of the mucus which is present in the lungs, mucus present in the lung segments. So in 18 positions we can tap the chest and back of the chest, so we can remove the excessive mucus which is present in the lung segments, that is 18 position, 18 segments. The next one is the length of the adult trachea. Okay, not required, trachea, about 10 to 11 centimeters or 5 inches, and the diameter of the trachea is about 1 inch. And the tracheostomy can be done on the second and third cartilage of the trachea. Okay, the trachea has the cartilages C-shaped, and the first one, this is the gap between the second and third. Okay, so here we can do the tracheostomy. Tracheostomy is nothing but making a hole to the trachea to take the respiration. So the next point is mean pulmonary artery pressure is about 10 to 20 mm of Hg. Okay, mean pulmonary artery pressure is 10 to 20 mm of Hg. And the next question is, which among the following diagnosed based on the Reed-Sternberg cell type? Reed-Sternberg cell type. Options are Hodgkin disease, non-Hodgkin disease, nephroblastoma, hepatoblastoma. The right one is option A, Hodgkin disease. Hodgkin disease is related about the lymph. Okay, so in this Reed-Sternberg cell type, you can see the lymph cell consists of more than one nucleus. Okay, that is called the Reed-Sternberg cell type of Hodgkin disease. So the next one is tumor of the hyaline cartilage is called osteochondroma, osteosarcoma, enchondroma, chondrosarcoma. The right option is option C, enchondroma. Enchondroma is a type of cancer which is arise from the hyaline cartilage. Hyaline cartilage is it is present at the end of the bone. So here we can have the hyaline cartilage. The next one is what is cachexia? Options are weight loss, muscle atrophy, loss of appetite, all of the above. So the right option is option D, all of the above. So cachexia, it is a clinical manifestation we can see in the case of cancer. Okay, so in the cancer, the patient will have the weight loss and the muscle atrophy. Atrophy is nothing but decreasing of muscle consistency and loss of appetite. Loss of appetite. So all the bad clinical features we can see in the case of cancer, that is called cachexia. How many times has to do hand wash when treating a patient? Okay, so as a nurse, when you are going to treat the patient, how many times you have to do the hand wash? These are called movements. Okay, so these are not the steps of hand washing, movements. So how many times? First one is before touching the patient. Okay, before touching the patient we need to go for the hand wash. And the next one is before clean the procedure. Okay, so when you are planning a procedure for the patient, so before starting the procedure you need to go for the hand wash. And the third moment is after body fluid exposure. For example, urine collection, otherwise specimens, otherwise some drainage, otherwise wound, whatever the procedure or body fluids when we are going to exposure for the risk, before after the touching of the body fluids. And the next one is the after touching of the patient. Okay, after touching the patient also you have to go for the hand wash. And finally, after touching the patient surroundings. For example, surroundings are nothing but table or patient bed or the patient drugs, case sheet. Okay, all over the thing. So the movements of the hand washing are 5. The last one is pressure ulcer stages. So pressure ulcer is nothing but it is a kind of wound which develops over the bony prominent area. For example, the skin, the bone which is present near the surface of the skin. For example, joints of it may be the hip bone. Okay, femur, head of the femur. So head of the femur is closely related to the skin, surface skin. So here we have the risk for the pressure ulcer. Okay, so the stages of the pressure ulcers are first stage 1. So in this stage, the epidermis and mostly dermis is less in epidermis are highly affected, dermis is not that much affected. So this is a first stage and risk for the pressure ulcer, formation of risk for pressure ulcer. And the second stage is the epidermis and dermis are affected. Okay, in the second stage. So after first stage it turns into the second stage when you are not treating a patient with a pressure ulcer. Okay, it is a risk for pressure ulcer. When you are not treating in this stage, it goes to the stage 2. So in this stage 2 it increase and it goes deeper to the dermis layer. Okay, and the third stage is when you are not treating a patient with a pressure ulcer, it goes to the stage 3. So in this stage 3, epidermis, dermis, and it closely touch to the subcutaneous, that is nothing but fat. Okay, so if you are not treating still, it goes deeper. This is third stage. And finally fourth stage is It is almost touching to the bone. Okay, bone present, we can see the structure of the bone. That is fourth stage, still you are not treating. So it goes to the dermis, epidermis, subcutaneous, muscle and bone. Finally you can see the bone. These are the stages of the pressure ulcers. Thank you guys for watching my video. Please subscribe and prepare well for the aims norcet examination. Thank you.